Over the last couple of months, you've heard a lot about COVID-19. One of our efforts has not wavered in regards to our commitment to your safety and our focus on quality. Our emergency room has continued to be available to our region 24 hours a day, 7 days a week. We've instituted a number of steps that should someone arrive or be suspected of COVID as to how we manage those patients when they come and present to our emergency room. Our standard processes now in regards to mask wearing, to temperature checking, to screening individuals in regards to certain questions, and to then that clinical management have allowed us to very effectively treat a handful of patients. Those folks have been housed in separate area within our organization as well. I'm joined today by Dr. Stephen Pasternak, our Chief of Staff and our Medical Director for our emergency room.
If you present with symptoms that may be suspicious for COVID, well, first of all, we'll use universal precautions for our staff and for our patients, but we'll also put you in a special area in the emergency department. And that will mean a reverse ventilation room, door closed, away from the rest of the population.
We've heard a lot of national discussion around folks having signs and symptoms of other major serious pathologies that they've chosen not to come for fear. What should folks do in those circumstances?
We're not seeing as many people show up in the emergency department as we used to with a lot of the common ailments that can be life-threatening. For example, a heart attack, stroke, serious infection besides COVID, significant abdominal problems. And it's concerning to us because we know it's still out there. People are still probably having mild heart attacks or strokes, and they're just not coming to the emergency department. So I would say, if you're having symptoms, in addition to shortness of breath, as chest pain, neurological symptoms like dizziness, loss of sensation or weakness, or change in your vision or speech, those would all be signs of a potential stroke. We would want you to come in and be evaluated, because we can give you treatment to reverse that. Any significant abdominal pain we would want you to see, because it could be catastrophic. And then of course any trauma, instead of letting things kind of heal on their own at home, come on in and we can evaluate you and make sure that any of your injuries are appropriately taken care of.
Your hospital with LewisGale System, your physicians and your other healthcare workers, our nurses, rad techs, pharmacists, etc., have continued to provide amazing care. What we do know and appreciate is that every time you come here, you give us your life in our hands. Our responsibility to that is significant, and our unwavering commitment in regards to our efforts around safety, certainly at this time, but without question what we've been doing for years and what we continue to be known on will continue for the future. Thanks very much for trusting us, and if you need us, we're here.